No, Mom, I'm not with him anymore. Stop nagging me about it.
Michelle, do you know what Jill did to me? She put my mouse in Jell-O again, and now it's getting all sticky, and then I
don't have time for this right now.
But you need to fire her. She keeps doing stuff to me.
Jell-O? What flavor?
Green lime?
Everyone, conference room now. Ladies and gentlemen, I have some bad news. My grandmother fell down the stairs, and I had to drive her to the hospital.
Is she all right?
The doctors tried to save her life. They did everything they could. They said she needs a bone graft. What's a bone graft anyways?
A bone graft is a surgical procedure that replaces missing bone in order to repair bone fractures that are extremely complex, pose a significant health risk to the patient, or fails to heal properly.
Well, all right. So I want to find the best device. I will reward the person with the best design.
Michelle! There are more than 500,000 bone graft procedures performed in the U.S. each year and approximately 2.2 million worldwide. The estimated cost of these procedures approaches $2.5 billion per year. The range of devices go from injectable bone grafts to moldable bone grafts. The classes of materials include allograft-based, factor-based, cell-based, ceramic-based, and polymer-based. After the orthopedic and rehabilitation devices panel determines if the product's benefits outweighs the potential risk and approves the device, it takes 3 to 6 months for the FDA to approve it. In terms of the FDA process, a summary report needs to be submitted that includes the following information. 1. Description of the device, such as the composition of the material, physical properties, material characterization, biocompatibility, sterilization standards, and its intended use. 2. Description of the design device. 3. Identification of the risk analysis method. 4. Discussion of the device characteristics. 5. Description of performance aspects such as biocompatibility, sterilization, and labeling.
Thanks, Whitney.
What's the reward?
It's a surprise. The most sacred thing I do is care. Today, I'm in charge of picking a great new bone graft, right? That's what this is all about. Does that make me my Nana's doctor? Yeah, like a specialist.
You don't have a chance.
Well, you don't have a mouse. I think it's great that Michael is taking off his time to find a biomedical device for his grandmother. I mean, it's not like he's a doctor. But here's what I found so far. Apotec is a world leader in orthobiologics. They developed Actifuge, which is a silicate substituted calcium phosphate bone graft. I know, fancy, right? It is a synthetic bone graft material that combines osteoconductive, osteostimulatory, and bioactive qualities resulting in bone growth. The unique feature of Actifuse is its phosphate groups have been selectively replaced with silicate groups. The negative charge allows for protein adhesion, especially proteins with the RGD attachment. These proteins adhere in proper conformation, allowing for more protein attachment. Osteoblast cells are then attracted to the adherent proteins. Actifuse is a moldable, cohesive, and versatile bone graft. The macro-micropores allow for the pre-passage of cells, fluids, nutrients, and signal molecules that support rapid bone formation. In a study of 3 bone graft substitutes, dense calcium sulfate, ultraporous tricalcium phosphate, and silicated calcium phosphate, the silicated calcium phosphate has been better opposition and appeared to be more stable. The Journal of Surgery has stated that silicated calcium can bond directly to bone. Look, they even have their own video.
I wonder what the reward is. I really hope it's a gift card to Macy's. There's a pair of Prada shoes that I really want. It's 5-inch heels and it's made out of leathers and it has the unique design of cross-linking braids. They are light brown.
Ellie, it's not going to be a gift card. It's going to be a promotion with my own office. Question. Why does she keep thinking it's going to be a gift card? Michael never said that. It's going to be a new office and a promotion. Anyways, my device is a bone graft replacement from the company of Dupuy. This device is made out of cross-linked type 1 collagen fibers that are fully coated with non-ceramic hydroxyapatite, which helps cell attachment, proliferation, and differentiation. Hydroxyapatite is a naturally occurring mineral form of calcium apatite. When mixed with autogenous bone marrow aspirate, the matrix also remodels into new bone throughout the graft site. Obviously, there's a reason why mine's the best. The result is an osteoconductive, highly porous, and three-dimensional mineralized structure with a composition similar to bone, which creates a more natural human response as opposed to my other colleagues' devices. When combined with bone marrow aspirate, the bone graft provides an excellent environment for osteoprogenitor cell attachment and bony ingrowth. When it is implanted with bone marrow, this provides the osteoprogenitor cells for bone formation. It also conforms to the implant site, providing significant bone-to-matrix contact. Even top research at the National University for Research in Inorganic Materials in Japan, the University of New South Wales, and the Tokyo Medical and Dental University support these findings. This just shows that there are 3 words to describe myself: hardworking, alpha male, jackhammer, merciless, insatiable. I'm definitely going to win that promotion.
I know Michael's giving out a gift card to Macy. There's a great pair of shoes calling out my name. I've been looking into the ISTO company. The company engineered InQ bone graft, which combine polylactic glycolate PLGA and hyaluronic acid biocompatible materials to optimize the safety and effective clinical use. PLGA is a copolymer and provide compressive resistance and a reliable resorption rate at the site of implantation. Hyaluronic acid is widely distributed polysaccharide extracellular matrix of connective tissue and bone marrow. It plays a critical role in tissue regeneration and repair. It also helps with the bone formation by promoting migration, proliferation, differentiation of osteogenesis cells. Compared to other synthetic bone graft substitutes, InQ offers surgical advantages along with the normal process of endochondral bone formation instead of replacing osteoclastic remodeling. The patients can return to unrestricted activity after 12 weeks of implantation. This is very recent technology approved by FDA in 2007 to use as an extender or as a substitute. These advantages make my device more special. I bet I will win the prize for sure now.
So, Angela, what device are you researching?
Hey, I don't think I haven't had time to do any research on my product yet.
Why Donnie is so nosy? This is competition. I'm not going to talk anything about my device. Anyway, infused bone graft consists of 2 parts, a protein that is found in human body and natural carrier for delivery. The protein ingredient in infused bone graft is RHBMP2, which is recombinant human bone morphogenetic protein 2, a synthetic version of protein. It's produced naturally in small amounts to regulate bone growth and healing. The natural carrier is made of a material found in tendons. It releases the protein over time where it's placed, provides a scaffold for new bone to grow into, and is absorbed and replaced by bone. Choosing infused bone graft eliminates the need for harvest surgery, the pain, bodily harm, longer surgical time, and more anesthesia associated with the bone harvest position. However, any surgical treatment to promote bone growth is not without risk. A variety of complications which might occur individually or in combination related to surgery or the use of infused bone graft can occur. They include allergic reaction to implant materials, bleeding which might require blood transfusion, bone formation that is not normal, damage to nearby tissues or nerve, scar formation or other problems with surgical incision from anesthesia or the surgical approach, skin swelling or irritation.
What are you watching?
Just a video about my device. You want to take a look? The silicated calcium phosphate is allowing the protein to adhere in proper conformation.
Well, mine doesn't need a video. Plus, mine's natural, so it won't have as big of an immune response as your device.
I'm going to win the gift card. Natural doesn't mean it's better. Mine has a long history of being successful in clinical use.
Wait a minute. Calcium sulfate requires a dry environment to set. Mine has the shortest surgical procedure than all of yours combined. That price is mine.
We'll see who wins this reward.
They think I'm not part of this competition, and all I do is Sudoku all day, but I'm actually doing work. Their companies are nothing compared to mine. The company OrthoVita has a bone graft, Vitas Bioactive, that has been shown to be comparative to autografts in human clinical trials. Vitas is made from beta-tricalcium phosphate. It is the most porous bone graft on the market, having 90% porosity with ranging pore sizes from 1 to 1,000 micrometers, which facilitates all the biological processes of bone regeneration. Although this amount of pores lowers the structural strength of the graft, beta-tricalcium phosphate is a strong ceramic material, and studies have demonstrated its perfect biocompatibility and its ability to be used as a resorbable bone implant. The pores also allow Vitas to be absorbed faster than other bone synthetic grafts. The bioactive part in Vitas grafts is made from bioactive glasses, shown to enhance bone growth by the slow elution of cell-activating ions of sodium, calcium, and silicon. The release of these bioactive ions leads to the formation of a silica-rich layer on the surface of the glass, creating a site for the deposition of calcium and phosphorus to form a hydroxycarbonate apatite layer, HCA. The osteoblasts that colonize the surface become encased in a collagen and HCA mineralized matrix, causing for a direct chemical bond between the newborn bone matrix and bioactive glasses to form. Having bioactive glass in a Vitas graft has shown to be 6 to 12 weeks faster in returning to the bone's native strength than a graft without bioactive glasses. This is because new bone growth is developing on and around beta-tricalcium phosphate scaffold and bioactive glasses granules, allowing for a deeper integration of new forming bone. Overall, Vitas Bioactive exhibits stronger, more abundant bone formation earlier in the healing process, making mine better.
Michelle!
You should choose
Stop! Everyone stop! False alarm. My grandmother just sprained her ankle.
What?
What?
Then what about the price?
The reward is that my grandmother's okay.
That was a waste of my time.
Honestly, I don't think any of those devices were the best. But if I had to choose, I would say that ceramics are the most promising material because they are the most like bone. It is corrosive and wear resistant and would be strong enough to withstand compressive forces. It also has the most natural interaction with cells in the body. They still need some further improvements, such as the rate of degradation of the material and the recruiting of the correct cells to improve proliferation of osteoblasts. We need a material that has more pores to increase the rate of degradation and integration of cells, but still withstand the compressive forces applied to the graft. Also, the addition of bioactive glasses or ions can improve a material by recruiting the proper proteins needed for cell proliferation. So even if my Nana needed a bone graft, none of those would have been good enough for her anyways.